Today's tips are for the men. Ladies, you could probably get something out of it too, but it's Men's Health Awareness Month. Fellas, Dad, my dad, he just doesn't take care of himself. Is that most men?
Well, I wouldn't say most men, but a good portion of them.
Okay, I'll say most men. He doesn't have to say most men. Dr. Mohammad Mathbout is here, interventional cardiologist, Norton Heart and Vascular. Do you take care of yourself?
I try to.
Okay, just try to catch him here. See how he does. So this June, Men's Health Awareness Month, heart disease is the leading cause of death for men. Why is that?
Well, there's a number of reasons. Some of them are hormonal, some genetic, and some environmental. We know for a fact that men develop more heart disease than women do. Although when a heart attack happens, a woman is more likely to die. But that being said, when we look at these factors, men tend to develop a little bit more plaque formation in their coronaries, and over time that shuts down those vessels, and leads to heart attacks. There are some environmental factors, smoking. Men have the tendency to take less care of themselves, so their diabetes is less controlled, their diet is usually a little bit worse, they're more likely to be smokers. And they're more likely to push things under the rug. So when we come to find out about all of these symptoms, they've been going on for a while, and we're left to deal with the aftermath of these things.
See, that's what I'm saying. They don't take care of themselves. That's what I'm saying. My father, I know he was ill for a long time, and yes, Dad, I'm talking about you. I know that he had prostate cancer for a long time because he was not feeling well, and I know he knew it and only took care of it when he didn't have a choice. Yeah. But then when you do that, the problem is greater.
You pay it with interest.
Right? So the best thing to do for men, what would you tell them to take care of their health?
So what I would say is that know your family history, right? Because we cannot escape our genetics. If people in your family die of heart attacks, you're more likely to die of a heart attack than you are to die of cancer. So know your family history, get screened early on. So if you think you're a little bit overweight, then screening for diabetes, check your cholesterol levels. Have a family doctor or your primary care doctor do the things that are indicated for your age and weight category, and control these risk factors. If you're a smoker, quit smoking. If you cannot modify genetics, but you could always modify modifiable factors, and if you do so, you're taking control of your own destiny. Okay,
so heart disease being the #1 cause of death for men. How would you know, all of us do this, I think, or maybe I'm the crazy one, but you know, you feel the pain in your chest or something, and you wonder, oh, you know, well, if it's a bad one, oh my God, you know, am I having a heart attack? What are the signs of heart attack? And for women, it's different.
That is true. That is very, very accurate. So the classic symptoms of heart attack is chest pain or chest pressure. Often people describe it as something sitting on their chest or giving them a tight hug. I've had patients with a heart attack on the table tell me it's not pain, it's just tightness. It feels squeezing. Often there are warning signs. Shortness of breath when you're doing things that you were able to do before. Climbing up 2 flights of stairs is something you were able to do a month ago, but now you cannot. Less common symptoms would include things like syncope or loss of consciousness that is sudden. Shortness of breath, sweating, and nausea, and are also things that happen when you have a sudden acute event or a heart attack.
So you don't have a sharp pain?
Sharp pain is often atypical of a heart attack, correct. Often would reflect pain that occurs with lung issues or aortic issues, the big vessels in your body, but not necessarily with a heart attack.
What about that right arm thing? Is that still?
That is true. It doesn't have to happen all the time, but chest pressure that radiates to the jaw and or to the arm is something that people with an acute event do experience. You brought up something which is that women do not have typical symptoms, which is very true. true. Although we have more events happen in men, women have worse outcomes. And this is largely because we miss heart attacks because the symptoms are not as typical. You don't get the same chest pressure necessarily. It's mostly nausea, vomiting, and sweating that that women experience with some shortness of breath.
And we tend to just keep going, and then it's too late.
They think it's just a bad stomach ache.
Yeah.
And by the time we find out about it, it's too late.
So the biggest things that you would want us to know, you've told us, know your history, do all that, know your blood pressure. If you're on blood pressure medication, certainly take that medication.
Correct.
Take all your medication.
If it's in your cabinet and you're not taking it, it's not
Shame
helping
on you.
It's not helping.
Are there any things that you want to make sure that you definitely get in that men need to know?
Well, be in tune with your body. If you notice symptoms that are concerning to you, we should know about it. It's always better to treat things and manage them early than to wait on them and deal with the consequences. If you have risk factors, aggressively manage them. Control your diet, control your diabetes, do not smoke, exercise. 30 minutes of cardio 3 times a week has been linked to longevity. If you're sedentary, you'll pay the interest later. So if you control the risk factors, that is the best thing you could do to guarantee a good outcome.
Yeah, boy, we know all these things, and it's so very hard. Dr. Mohammad Mathbout, interventional cardiologist from Norton. Your website is NortonHealthcare.org. There it is. They've got it up there. Again, information that you can always use. It's Men's Health Month. Investigate TV is next. Thank you.
Absolutely. Thank you for having me.